CMMS Radio talks about all things CMMS, computerized maintenance management software, focused on maintenance management. It's the people, the process, and the culture that make your CMMS journey a success. Thank you for tuning in, everyone. Today, we're going to meet John and Laurie Masiello of Predictive Monitor. Now, right now, you can see on screen, if you're watching, this is Laurie, and we're going to talk about the journey, how this all kind of started, and we're hoping John's going to join us later so that we can get some of those insights. But at Predictive Monitor, their mission is to empower life sciences companies to improve patient lives by providing practical solutions to maximize equipment uptime, improve operational efficiency, and protect life-saving products. We're going to also learn about why Overshield is the future of GMP chamber maintenance. Laurie, welcome to CMMS Radio.
Greg, thank you for having me.
It's really fun, and we've talked a little bit before we hit record. And one of the cool things, for me is John's on site with a client, and I told you guys, hey, this is easy breezy here. This is not like an overproduced type thing. This is real life. And what I like about that is I'm a big fan of organizations that provide like impeccable or just strive for impeccable support when it comes to what they do and who they serve. So that right there is kind of why I wanted to shout that out at the front end of this episode, because that's important to me. I think outcomes are everything. Would you agree?
Delivering high quality standards, that's the goal. There's lots of people who provide service at this level, and there's very few people who provide service at that level. And that's been our goal from when we were at MASY and now that we're at Predictive Monitor.
Yeah. And the whole journey story is really fascinating. I've learned some about it. And one of the things, John said this, that in your dual roles, between the two of you, that you're the executor, the executioner, you execute on things. And
he likes to call me the executioner.
Yeah, well, I think he means it in the most positive way. But I wanted to ask you about some of your background. So if you go back to like the 80s and the initial formation of MASY Bioservices, you were also at that time very and still to this day interested in community. You've participated in things that have to do with standardization, standard developments, and those types of things. Can you give us a little bit of kind of color in the background for you, like from the 80s, and kind of bring us up to current into Predictive Monitor?
I'm going to jump back a little bit further to the 70s because that is ultimately the cornerstone.
Okay.
John and I went to high school together, and we met in driver's ed. And after driver's ed, there was that first date. And that first date was now 54 years ago. We dated for 4 years. We've been married. We will be married for 50 in August. So we've kind of been together for a long time. So we're two different brains, totally two different people. We see eye to eye on absolutely nothing. And for some reason, that makes it a really good partnership. But he is that side of the brain, and I am that side of the brain. So together, my children would say we're the parental unit. So we'll fast forward there. Somewhere there was the wedding. There were 2 kids. And John was working at a company and said, I really just want my own business. So it started out with he was calling it MASY. His last name is Masiello. He absolutely wanted a company named MASY since he was little. His grandfather owned his own business. His father owned his own business. It's the thing he grew up with. So at some crazy age, we decided this is the thing going forward. So we started with, what can we do to help people in industry? What is the thing that bothers them the most, the hardest for them to get through? And I'm going to say John started with parts, whatever that means. He made some little tool machine and made these little parts. And I would always say job satisfaction would be the most important thing to me since we were teenagers. I would never work at a place I didn't feel comfortable. And John started out with, I'll work any place where they'll pay me the money to do the job in front of me. And it's like, that so doesn't work for me. I would never have worked for money. So, so he would do these parts and say 5 cents, 10 cents, 15 cents, 20 cents, and then he'd have a whole dollar, and then he'd keep doing into the night, and $50 later, he'd be so excited. And so we did these parts for extra money, and eventually that morphed into what is our MASY, and working for pharmaceutical biotech companies. And we started in validation. And we would go do validation projects. And again, there's lots of people who do validation. And so you all start down at that lower level. And eventually you realize we have a higher standard. So we elevated our performance. And as we started MASY, we realized, how do you tell the world that you have a better performance? Well, we thought that was ISO 9001. So we got ISO 9001 certified. We thought that made such a difference. And then you realize every dentist and grocery store could have that if they wanted it. All it is a basic, but at least you took the time and effort to document processes, but it's still a basic thing. And as we morphed from validation, back up, we had our validation equipment. It needs to be calibrated. We would send it out to be calibrated, and then quickly realize we're not happy with the cal results because we're calibrating from those people, and we would need to elevate that for the services we're providing. So we started bringing calibration in-house. And once you're calibrating those things, you need to calibrate the thing that calibrates the thing that calibrates the thing. Next thing you know, we're calibrating super thermometers. We got invited to go to NIST. We got to see the keeper of the standards. Our standards were then being calibrated at NIST, and very few calibration companies won't ever get to go to NIST, but very few actually send their standards to NIST. Very few end up having a relationship with NIST staff. You could call them and ask for a question, brainstorm answers to things. With our calibration standards, we then had fixed points in-house. So we'd have the periodic table of elements, and we would put an M with our logo and our check mark on all the standards that we had. I don't remember if we had 6 or 8 fixed points in-house, so that periodic table of elements looked awesome with our little M's on it.
Yeah, but,
again, high standards. Absolutely felt we were best in class. We did best in class procedures. That morphed into a process where we said, how do we make sure other people have that option as well, not just the people at MASY? And then John started teaching at Mount Wachusett College, Mount Wachusett Community College, and Middlesex Community College. And he taught classes called Calibration 101 and Validation 101. So he could bring those introductory best practices to the industry. So our customers, our competition, the students in the school, but a lot of people from industry said, I appreciate the opportunity to learn from John, who's a subject matter expert.
Yeah.
And John has just arrived. We're going to give him 2 seconds to shake down and jump on in.
Well, there he is.
Hello.
The man himself.
How you doing, John?
Good. How are you?
I'm good. We were just kind of jumping in a little bit to the journey story. We're talking about MASY Bioservices and kind of leading up into that. And I think Laurie was getting ready to start talking about where the transition took place when the merger happened. We're kind of getting towards that with Alchemy.
They were almost 40 years that we were at MASY. And so a lot happened in those 40 years. And fast forward, in December of 2021, we met with folks at Alchemy, and we talked about a merger between the two companies. And at the time, MASY had 200, they had 800, and we thought we'd be 1,000 people strong.
Yeah.
And it was very flattering to us that a company of what we thought their caliber would be interested in this little services company from Pepperell, Mass, who somehow grew and had a global presence. But not only do we have a global presence, we, again, developed industry best practices, taught our competitors, our customers, what industry best practices would be, and elevated their game as well.
Yeah. So, John, when it comes to that journey, and Laurie was sharing how you just had to have your own company, you really wanted that kind of involvement and ability to, influence things with best practices. It started with some products, but I wanted to ask you very specifically how that passion developed for you as a young man, and then transitioning into, the workforce, and you've done the educational path, but then kind of making that rubber hit the road. Talk to us a little bit about that so we can hear it from you.
Well, any company I've ever worked for, or any time I've ever worked, I love working. So from seven years old and on, I just love working. I love doing things, getting passionate and making things happen. Any company I've worked at, it's always been about the company, management of the company is taking care of me. My job is to take care of customers or whatever the function is that was assigned to me, and that's what I always did. It was that my grandfather had said, it was numerous times when we visited him in New York, we'd always say something like, well, why don't you have your own business and your own job, your own company? And he always had a corner store with my grandmother. Mm-hmm. And we thought about it. My dad had a business, and it was a very small business, and we always had ups and downs. It was either 3 customers, and one was always on strike until 2 were on strike, and I learned a lot from that.
Greg, I just want to let you know, apparently they decided to start spring lawn mowing in our neighborhood right now.
Leaf blowing with the loudest leaf blower. Yeah.
So I hope you're able to hear over that. Sorry.
Yeah, we can hear it. Look, the real world happens, and we're not sitting in some production studio, and we're not checking all the boxes here. We're doing quite the opposite. We're having a real conversation in the middle of a business day, and a lot of people will understand that, and anybody that doesn't, we apologize for the noise, but the lawn's got to get taken care of.
Snow out there, and all of a sudden it's springtime today, I guess.
There you go. Well, getting back on track with the story, we were kind of heading into the merger with Alchemy and how that gave you this opportunity to be part of a bigger organization, make more of a difference. But ultimately, I want to get us to how the buyback took place, and that was the formation of Predictive Monitor. So I'll let you guys decide which one of you is going to start talking about that.
Part of it. Well, when we were doing the introduction at their site, and we were talking about each of our divisions that we had, and I don't know if Laurie's touched base with the divisions.
Yeah.
And this particular predictive, we used to call it the PMO, the Predictive Monitoring, PMU, Predictive Monitoring Unit, was something that we waited, and that was the last of the divisions. There were 6 divisions. The last one we presented, and I was as excited as I was on every unit. Passionate. When I got to that one, I said, everything we've done, this will dwarf everything we've done. Right now, it's very, very important. We got a little derailed with COVID and what have you, but this was really it. And they seemed to be excited and interested. But then once you look at the numbers, it was a product that we made for ourselves. And as it turned out, there wasn't an interest in it after the merger.
I think they viewed it as an R&D project, and particularly John's pet project that he was extremely passionate about. But there was no revenue. It was expenses going out. They said that wasn't the plan that they had. And if it was an R&D project, why don't we take it back, and then we could continue to develop it.
So they said, yeah, we're all about that. And then you guys took it back and did what you actually wanted to do.
Yes.
Yeah.
Yep.
So now they're...
Let's clarify that. You said do what you wanted to do.
Take it back.
I thought
buyback.
I was going to be on a Caribbean island doing what I wanted to do. And instead, I'm working every single day now to go forward with the Predictive Monitor mission. So I'm not sure when that do what you want to do plan came in.
Well, sometimes it changes, right? And that's another thing about, business, entrepreneurship, and all that stuff, where you got to sign up. You're signing up for that. a lot of people have this idea that you're starting a business and it's going to do all this cool stuff for you and you can go do a bunch of other stuff. Well, not really. You gotta be in there, you gotta work it, and you gotta kind of shift and change your goals as you go along. And I'm no expert. I've been through it, but it's different for everybody and somehow all the same. I just think everybody's got a unique journey story as it relates to that. So
I say,
when it
Greg,
comes to
the real reason that we're here, though, ultimately, is we thought they would continue to develop what we were calling the predictive monitor units. And since they did not, we were sure it was way too important for the industry to just let it lie. So I gave up my concept of hanging out at the Caribbean, enjoying myself, and thought this is too important. The industry needs what we've developed.
now that's the most, to me, the most important part of this whole journey is that intentionality. And I talk about it a lot about, that I'm interested in the specificity and what you actually do and who you really serve. And you're very focused on, biomedical and these types of environments rather than everything to everyone. And that's important as to how you can be the right kind of an expert that continues to grow, meaning you're paying attention and you're very plugged into the industry, really soup to nuts. Like you think about it, you're passionate about it, you care about it, you understand the outcomes, you understand the advantages. And a lot of this relates to what I talk about on CMMSradio because it's, of course, part of the maintenance process. It's in a very specialized sector where lives are at stake. And anything that can do prediction or even go beyond that to improve our critical equipment, our assets operation is what this is all about. It doesn't matter about the CMMS software. It matters about the other things and the people in the process that are doing the things that keep the things moving. If that makes any sense. I mean, it sounds kind of weird, but tell me a little bit more about Predictive Monitor and what it really is for someone who would understand it already, and also a little bit for someone that doesn't know what that is.
Well,
I would do a better job at the layman terms.
Yeah, we get to that, but I did want to touch base is that when you're talking, when Laurie's saying this is her focus and this is our focus as a company, and all of our teammates have the same objectives in the same directions. That's where the passion is. We don't want any product out there for the pharmaceutical life sciences to fail. Whether they anywhere along the journey to have a failure, it's just heartbreaking. So this is what we're all about. So Laurie has over the years, Laurie reviews me at the end of the year. I review Laurie. Okay, and we have a great point where Laurie will have. It's the 80-20 rule. Find 80% of the things that I could really need help on, and I take them very, very solid, and then 20% of the things that I do really well. And of course, the other way around, I struggle with 5% of the things where Laurie needs to improve on, and there's 95% that she does either better than me or just better than anybody. But one of the things, my negatives, is that I have to focus on the top 3 things, not just everything. All right. So this is why. So the reason we focus on the life science industry and the pharmaceutical, biotech, and medical device is because that's our background. That's what we do, and we focus on the refrigerated system. Anything with the compressors and refrigeration system, that's in our wheelhouse. That's what we know so well from our experience, our history, for all these years. So there's many other equipment pieces we could do. We focus on this, and that's what Laurie would always tell me: top three. Don't forget the rest. Top 3, and that's where the whole team. These are the assets we aim on. We can talk about so many other assets, and every time we go into a client, they'll say, "How about this?" And we're like, "Let's how about what we're doing?" And then we'll get to that. Have to do that.
So, Greg, silly little things will happen. Like today, the refrigerator at work went down. And, of course, we all joke, if only we had Overshield on that refrigerator. And then you think, what are those valuable assets in there? Well, yesterday's leftover pizza, so clearly no one is going to pay
You had to eat
to
them
have
today.
an overshield system on your home refrigerator. It doesn't make sense. You're just going to throw the pizza out or the milk that got spoiled. But
Yeah.
for pharmaceutical companies who are coming up with a cure for a horrible illness,
orphan drug,
an
very
orphan
limited.
drug, a vaccine batch to save lots of people, prevent illness. I mean,
Patient
there's
samples that are irreplaceable.
there's
Mhm.
so many things in there. In vitro situations where you've heard on the news where the eggs were lost. I mean, those are families who are counting on those for future for their children. It's just the world is too big. The issues are too big. They're too important. And so Overshield is that shield that's over everything. It's protecting them. It's not only protecting the refrigerator or the freezer or the warehouse that those things are stored in, it's protecting those products. So if you've spent a couple of $1,000,000 on a really fancy refrigerator, you want to get the life expectancy out of that you're entitled to. And just like your car, if you don't do the idiot lights, the oil change, your tires are wearing down, your wipers are breaking, you need to fix those things along the way. But the car's got that figured out for you. You got the idiot light. You need this. Go fix that. You don't get that on your refrigerator, whether it's a pharmaceutical refrigerator or your home one. So that's where Overshield comes in. We have put sensors in those key indicators of failure, the early indicators, and say the compressor is acting unusual. We should look at the compressor. Let's target your maintenance to the thing that needs to be fixed right now. You don't have to replace the filter today. The filter's not telling us there's something wrong with it. But focus your time and energy on the compressor. But because we're giving you that early warning, you don't need to come in at 2 a.m. on Saturday to look at that compressor. This is an early warning. That compressor might not go for 18 months. You now have targeted Monday through Friday, 8 to 5 work to do. And it's going to revolutionize the whole maintenance side of things. Quality comes in once your freezer has failed and they say, oh, is the product getting moved? What went wrong? What procedures need to be updated? And we're saying we're catching this on the maintenance side of things before it becomes a quality issue. With our early warnings, your refrigerator is still operating 2 to 8. It's fine. The compressor's acting up. Fix the compressor as your maintenance issue. Product's not at risk. Refrigerator's not at risk. We have a win-win solution here.
Yeah.
And millions of dollars that product could be, but more
That's from the
importantly,
business side of it.
the life-saving things that are in there, the people who are depending upon that dose. You can now get that to market instead of saying that batch got thrown out. We have to make a new batch. 3 months later, we'll get that drug to them.
Yeah, and you were gonna add to that, John.
He more wanted me to stop talking.
Well, I give you a chance. Some of the things the analogy I like to work with is with a car. Okay, and I always make my son. We like to race together. But let's say I'm driving the car and he decides to pull the emergency brake on gently and quietly, whatever have you. And
something he might have done.
I'm sure he has. And you're driving along, and you're just going to give it a little more gas because you have it in you to put the pedal down a little harder. Okay. And as you go up a hill, you have to give it a little because you're setting it at 60 miles an hour, and you want to keep that. So with a refrigeration system, something's going to work a little harder, a little bit easier. When it comes down the hill, it's still going to be working harder because the emergency brake's on a little bit. Well, if he pulls it on even harder, I got to work even harder. Well, eventually the brake wears out. Maybe the tire gets a flat spot, but the car's still going 55 miles an hour till finally the wheel falls off. In our industry, right, pharmaceutical, what have you, as long as my gauge says I'm at 60 miles an hour, quality says it's good, regulatory says it's good, engineering says it's good, the end user says it's good, stability group says it's good, everybody says it's good, right? But as we know, I just lost 2 tires, rims, the thing's driving on the back bumper, and we're still going 60 miles an hour. And when finally it gets below 60, there's a flag that gets up and says, you got to do something about it. Well, that happens all the time. So,
and
yeah.
what could have started as a mechanical failure now becomes a human error somewhere.
Oh gosh, I could
Where's
have
the
just smacked
flaw
him,
in the
and I could have
process?
smacked him. He would have get his finger off the button, and we would have been good to go.
Well,
That's
it's really interesting because I've had a couple of conversations lately. I've even had some episodes where we talk about from a maintenance and maintenance management perspective and equipment failures of any kind, even minor disruptions. There's kind of a debate. It's both necessary and unnecessary, right? It's kind of a little bit of a misnomer, but there's this debate between operations and maintenance. Who is the contributor to the failures? And it actually tends to be often operators, and it's usually maintenance that takes the brunt of it. And what's interesting about everything that you said is it starts to create this opportunity for better awareness on how this really works. Let's just take a minute and realize how this really works so that we're all moving in the same direction. I'm kind of twisting it up a little bit, but I think with the technology that you have, the idea is that we don't have to get to the idiot light stage. We don't have to get to the, oh, now we've finally dropped below 60. We have a problem. It's more about you already had a problem, and this helps you see that. It gives you a clue, an indicator. How does it work from the standpoint of things like overall condition monitoring? Because I think condition monitoring tends to have a few different interpretations. There's different types of condition monitoring. Can you help us understand the specificity of what it monitors as it relates to the compressors and things? Is it temperature? Is it vibration? Is it, on and on like that?
Yeah. The key contributors would be thermodynamics to speak of. So we're talking about the temperatures and pressures, right? When something goes wrong, right, the first thing that you call is the refrigeration person. They come down, they have the gauges, they have questions to ask. There's a lot of information that they don't have, and like anything else, the ship's sinking. Okay, what happened? And so you have to deal with it. So for us, we will be monitoring. We'll install it to begin with. Get it all installed. It'll be temperatures and pressures, and then there were currents, so we know what's happening with some of the loads and what have you. And then did somebody open the door? Okay. Then we have outside temperature conditions because we want to know, what's going on with the environment. Is it really hot? Maybe it's in a room where the HVAC is critically important for a region to be at that temperature, right? It's only designed to work between 25 and 30 degrees, right? Well, it's 40 degrees in the room. Well, you need to know that because otherwise, there's nothing wrong with the chamber. It's the environment that it's in. So there's a number of...
It's working harder.
It's working harder to the point where it can't handle it. It's over 95 degrees Fahrenheit, and that's what engineers design the outside for. Well, it's at 104. Well, it's going to fail. Something's going to go wrong. It's going to be stressed. Now, maybe it can hang on, but if things are already like low in refrigerant, maybe things are having a problem. So anyways, we're monitoring all these things. We turn it on, we put it in, we run it for 2 weeks. With 2 weeks is a critical component to say, well, how's it going? Well, some of our competition says that 2 weeks or whatever that time frame is good enough. And that's a baseline. Well, if it's running like crap, how do you establish a baseline? You have to evaluate that baseline. So what we do is we look at it, categorize it, understand what type of freon, what refrigerant is on there, the size, a number of engineering components of it to say, you need to do this, that, the other thing, right? And so at the end of the 2 weeks, we give them a report card, and the report card...
We also want to optimize it there.
We
want it to be optimized, operating at its highest, possible way, and then freeze that as the baseline.
Right. And so when we give that report card and we're looking at the data as we're going across, let's say, like the car, it's 60 miles an hour. Who cares? Everything's fine, right? That's not the baseline. The brake's still dragging. What we look at, as Laurie says, is we have to optimize it. Like maybe it's short cycling, and the compressor going on, off. Well, you know what? That probably looks really good on the end data. for the temperature in the chamber, because it's not cycling. It's almost a straight line. So that's a problem. Or if the refrigerant charge is low, you're looking at the pressure, looking at number of the deep-rooted things that a technician is going to look at. And then all the questions the technician would ask, like, did you put a hot load in there? Did somebody leave the door open? Is it summertime outside? Maybe they're located somewhere else. We're finding out, yeah, it's really hot, or it's really cold, and all these things. Well, if you have all that information, all the data, all that criteria, and you compare it to, after they've optimized it, right? Because we've told them you need to optimize it. We gave them a score, and the score might have said, it's problematic. These are the things you need to do to get it to a high score. And when you get to a high score, that's our baseline. Now you've got a real good base to compare it to as it goes along. And that's what we do. And
so, Greg, if your diabetes insulin drugs are in that refrigerator, don't you want to know it's operating in an A1 condition? Or do you want to think you got the D version, and it's freeze-thawed?
It's lost its efficacy. It's useless. It's still liquid. It's still going to go in your arm, but it's not doing its effectiveness.
NIST did a study a number of years ago about vaccines and why people
with Greg Strauss.
So while people were getting vaccinations from their doctors, their little country doctors who had a little dorm-style refrigerator, that vaccine was freeze-thawing constantly, and the vaccine wasn't effective. And you were having people who were vaccinated but were still getting sick from the illness. And it was like, well, where's the problem? It's mechanical. The refrigerator wasn't appropriate for the use. Mm-hmm. It couldn't deliver a steady 2 to 8 refrigerated temperature. You were freeze-thawing every night, all weekend long, and just losing value.
Yeah, well, it's a very obvious area of risk when it comes to public health, all this type of thing. But so many of us take it for granted. But the idea here, and the reason I wanted to hear you guys explain it, is you start to put those things together. At least for me, while I'm listening to it, and I'm kind of putting together the maintenance things. I'm putting together kind of the bigger picture. Why does this really matter? And then I come all the way back to why I'm always so excited about specificity and functionality, because, Industry 4.0, there's so much going on out there. There's a lot of noise. There's a lot of shiny, cool tech. There's a lot of, hey, we've got this, we've got that, and it's surface level stuff. And I'm not trying to tear anybody up. I'm just trying to say that we need ways to find out who's really doing something that actually makes an impact, rather than saying that they make an impact. And when it's tied directly to that specificity, I get really excited, because later on it can be something for more. But knowing who and what you are, who you serve, why you serve them, all those things I think are critically important to how a business makes an impact in the world. It might sound kumbaya. That's not what I'm talking about. I just like the idea of doing good business and knowing what you really know. So I think that's where I want to switch it and ask. This might be a little bit of I'm kind of taking a dig at the industry as a whole. So Industry 4.0, we understand what that is. There's the Industrial Revolution, and then there's also Industry 4.0 as far as leveraging technologies, and there's a bunch of stuff that's kind of wedged in there. I'm going to ask both of you, but we'll start with John. Industry 5.0, is it a thing or is it hogwash?
Well, we're calling it Pharma 5.0 just because of our side of it and what have you. And what it is not just leveraging, automation, not automation, but advances, technology, what have you. But it's also, and I'm not really keen on the phrase, but it's utilizing the expertise from people and technology. It's not just automating and running its thing and being happy with it. It's perfecting it, because that's how you perfect things, going back and forth. All right.
Yeah.
And that's the big thing that we're so excited about for it.
Okay. And then what would your take be on this, Laurie, when it comes to this kind of question I asked, where I'm saying, is there really an Industry 5.0 or what?
So When back at MASY, when we started putting our Overshield product, our predictive monitoring units on our chambers, we were, as I would say, babysitting other people's products in our chambers. And it just kept being, well, what else can you monitor to be sure? We don't want to be called because the 2 to 8 is now warmer than 8. Couldn't we have been called when it was 7, 7.5, something? And that's when we came up with this concept of when there's a change, then we would be notified. So if this refrigerator that runs from 2 to 8 always runs from 4 to 5, the second it goes over 5, it should be cause for alarm, because it could go from 5 to 8 in a heartbeat. And we would then come in and say, there's a change going on. What's the change? And that's what developed into our Overshield product that we're now selling. It's Predictive Monitor.
That's true. We had an intermediate process, which was from many, many years ago, is that, Greg, as you imagine, as Laurie said, so if you get a better chamber, okay, because everybody had chambers that if it made it between 2 and 8 degrees, in other words, when we mapped it out, we had 16 sensors in there, and as long as they all met 2 to 8 degrees, or excuse me, 1.5 rounds to 2 and 8.4 rounds to 8, and as long as it's within that range, you got 2 thumbs up and everybody's happy. And so it was important for us to get a better chamber. So that was for us. When we started our MASY services for storage, we already tested thousands of chambers, dozens of manufacturers. And so when we did it, we're going to pick the manufacturers that work. And then we work with them to make it even more precise. And to make it more precise, we put more insulation on the walls. I mean, we had a refrigerator that had a 78 R value on the walls. All manufacturers said they weren't going to do it. And I said, I'll find somebody that will. And we found somebody that made the panels for us that we put it in. The manufacturer of our choice said, fine, we'll use them. And now we have a refrigerator that has that R value. So, which means then it's easy to control because there's less heat loss. So anyways, we put it through the process. And Laurie said, as long as that temperature is narrower and narrower and narrower, then when there's something that's acting differently, we would then be able to react better. So what we did is
have more time to respond.
Much more time. So what we did is in the validation effort, which is unusual in any other industry, on the validation, we call it the mapping effort, in a warehouse or in that cold room, let's say, we put many sensors, 48 sensors or something in a relatively small cold room. And what we did was we ran it empty, then we loaded it up simulated, okay, with an A system compressor, the B system compressor. Well, in this particular warehouse, we had a C and a D. So we ran it with all these under A system, so we ran many, many, many studies. And what we found was, what was the hottest temperature any of those locations, which was 1 inch from the walls, 1 inch from the floors, 1 inch from the, what was the coldest it ever saw, and what was the hottest it ever saw. And I'm going to tell you, they were really, really close. They were close together. So it was.
But we had an exceptional chamber.
Because we built it that way.
Exactly. But in the real world industry, you don't always, that's the load zone for us, the 1 inch from the sides. You can't always have that. You might be 6 inches. You could be a foot. And if you start thinking about a small refrigerator, you've lost a lot of space in order for the air to circulate. Right. But our chamber worked that way.
Right. So what we would do is we would put 2 additional sensors, right? One based off of the hottest it ever saw during the study, one at the coldest it ever saw during the study, and then one in the mean temperature, okay? Well, if it's a 2 to 8, it better be somewhere at 5, because that's somewhere in the range, because you optimize it. You don't want to be hovering around 8 to 5, 4.5. You want to be in the sweet spot, you optimize it, and you adjust it appropriately. Well, then, that hot and cold spot we would call performance alerts, right? Because we already tested it. Said, hey, it shouldn't get above that and it shouldn't get below that. So we might add 1/10 of a degree above and below. And as long as it's calibrated, we feel confidence. Now, as we run along, somebody opens a door and they open the door. Okay, or they put hot product in, it goes above it. That at least gave us an alert that said, hey, something's different. Well, fine. I didn't do that when we validated it. But at least it's an indication. If it's the middle of the night and it does that, that gave us, in some cases, a lot of time to say, something's wrong. Nobody's in there. Something's wrong. And we could react to it. That's before we put predictive on. This was back in 2007. So the idea was we try to get as much predictive information with the information we had. But in our industry and most others, one sensor is all you need. Why do you need two? Why do you need three? It costs 3 times as much, and you got to calibrate them. No, bad news. But for us, the value for that was really important.
So John talked about chamber selection, and just as we mentioned before, there's those people down here, and then there's those people up here. So picking the better chamber manufacturer is certainly a better plan, as opposed to getting the lowest priced that you think you can get a good deal with, because it won't hold temperature the way that the wonderful ones do. But along the way, not only is it just which chamber, but it's the technology changed. So the miniaturization of sensors, just the past 10 to 12 years, while we had the biorepository at MASY and how we were looking for a solution to get here, we had to find sensors. I mean, the original ones we had were probably about the size of my phone, and much thicker.
$1,000 each.
Needed much more real estate on the chamber to put the units there. And now we're talking about one, well, the size of my small Post-it notes. So, what a difference, and the cost came down, and it just made it more affordable, more reasonable. Again, the advancements in technology, sensor technology, Internet of Things, moving into AI and ML, the world has changed in the last few years for sure, and made predictive technology a real thing.
Greg, I just wanted to step on one thing. Is part of what I've seen is before our business at MASY and even post our business, I think it all starts and stops with management. Okay, it really does, right? Because what we would have in our MASY world, of the biorepository, the calibration, validation, all the other things, is that you have to listen. And with our team members, if the culture in the company is we want it right, we want it best, we have best practices, what have you, how can we, in the case of the storage, how can we never have a failure, right? Well, when you got people that care in the company and they want to share with you, they have input in the ground, down deep input to say, if we could do this, I think we could save some headaches, we could save some failures, what have you. And we had a lot of solid people that did that. And it's a culture that even the new people that didn't know that, or even some of the seasoned people that came from somewhere that says, thou shalt must do it this way because that's the way it's supposed to be, no changes, no nothing, it's got to be the same. When the culture changes, some of those people that were firm about no change realize that they have input, and they give input to the point to make a change. And it's a GMP environment, so you just can't make a change. You have to think about it, discuss it, and with the time, as I call it, I coin technical hacky sack. You discuss it, kick it around, and when you finally decide you're going to do it, you do it. But the support of management makes the difference, right?
This is where John comes in as our chief.
Well, how many times have people had good ideas to bring it up, only to be shot down because, well, first of all, it costs money. Well, where am I going to get the people for that? How important is that? We got something over here. I've allocated the money for it. Talk about it next year.
Happens in my world all the time when it comes to CMMS. People can't get buy-in for that from leadership because they're like, it's just another cost. And anyway, carry on.
Yeah. Well,
so that's where John is our Chief Innovation Officer, because creativity and innovating are like his main focus in life. And as we started before, he's the idea man, I'm the executor. I don't have a creative bone in my body. I would never have come up with the idea of a biorepository that we're going to store customer products at. But people who have ideas need people who would execute them. So he would come up with these things, and I would come up with one. We need to hire people. We need job descriptions. We need processes, procedures, and that would be my side of it. So the quality, documentation side,
the accreditation,
that's the part that's important to me.
Yeah, I like there's a balance to it, I guess, so to speak. So in everybody's first time on CMMSradio, you have to suffer through what I call the fun question segment. So we're going to get to that, But before that, I just want to ask one more question, and I want to pose this one to John.
That's okay. I can tell you like them better. I'm all right.
No, it's I'm gonna on the fun questions, I'm gonna try something a little bit different. But this, we're not at that stage yet. This is a question for both of you, but I want to start with John. This one is more about fundamental excellence. So why and how do the basic fundamentals play the most important role in how technology in maintenance, asset management, and all of it is successful?
Well, the only way you can implement the basic fundamentals is surround yourself with people that are more passionate and smarter than you, that have input to be successful. And that's what we've done. So,
Greg, when we were at MASY, we would have auditors come in and each one would say, how do you let people know that you're up here? As opposed to like everybody else.
2 audits every week for years. These people came from all over the world. It was about a day long with multiple people, 2 audits a week. It's grueling, but it is rewarding. And we would take all that information, and it was a formal process. We would take it.
They're helping us decide best practices. If they're asking us a question and we can't defend it, then we're in trouble right there. But if they're asking us a question and we're telling them this fabulous answer and they've never heard of that in industry before,
they say, I want that.
Wow, here we are as the leaders. And that's who we were. We were the thought leaders. But ultimately, one auditor came in and asked that question, how do you tell people you're so much better? And I said, you know what? Let's just coin that tagline, raising the bar for excellence. And he said, does it say enough? And I said, no, it's kind of a teaser line. And maybe someday they'll ask us, what does it mean? But other people perform at that level. I mean, it's just the way the bell curve goes. We never did. So we were always raising the bar for excellence. And we brought that mentality.
Best practices by training people.
And that's what Predictive Monitor is built on as well.
We've done that with many clients. Some of our coworkers would say, you can't train the competition. You can't train your customers because then you won't have the work to do. I'm going to tell you, the more customers we train, the more competition, which was our customers first, that we train, it just grew because we were the SMEs, and we'd transfer the knowledge, and they could lean on us anytime they started walking on the thin ice and said, if I walk on it, can I lean on you? And the answer was, of course you can. And then they would grow and go, but that transfer of knowledge, it was feedback. You get feedback. How can we be better? You got more feet on the ground out there trying to give feedback. I mean, that would be on any.
We would rather correct the misconceptions that are out there in the industry and not the best practices, and correct them to protect so much more. Instead of letting them go on making the mistakes that they make and then have to clean it up afterwards when they're no longer working there and we are.
Mm-hmm. All right. Now it is time. Fun question segment. Here's how it's going to work. Number one, there are no wrong answers. Okay, these are just say what you say. It's all good. And the way I'm going to do this is I'm going to start with one of you with the first question. Then the next one will get the same question, and then we'll flip it back and forth like that. So, very first question on the fun question segment. No wrong answers. This is for Laurie. What is your favorite music?
Kenny Rogers.
All right. Country music.
Yes. Well, particularly Kenny Rogers.
That works. John, what's your favorite music?
Rock.
All right. Like old school rock, new school rock. What, like heavy metal? A little less than that?
Yeah.
Led Zeppelin.
Led Zeppelin.
Who's the Jimi Hendrix?
Jimi Hendrix, my favorite.
You can see we're totally up.
All right. I like that. Jimi Hendrix got some good stuff. Electric House.
I was listening to that when I went into the MRI about a week ago, and nice. I had to play it while it's rattling, and it happened to be in unison, and I was smiling.
Yeah. It solved that issue. Yeah.
Yes,
okay. Fun question number 2. Now this is going to be for John, and then it'll go to you, Laurie. What is your favorite sport or hobby? And on sport, it does not have to be one that you play. It could be one you like to root for and cheer for.
Sport. I like running. I like running. I always like watching the marathon and running the marathon. So that's kind of my favorite.
All right. Laurie, what's your favorite sport or hobby, whether you play it or not?
On my back wall is Danny Ainge at the Celtics. We had Celtics tickets for a number of years. I really enjoyed the Boston Celtics.
All right. One of our favorite, angriest people on the planet.
Yeah.
Fun question number 3. This is going to be for you, Laurie, first. No wrong answers here. What is your philosophy or perspective, opinion, anything at all when it comes to the concept of work-life balance?
Well, we have a really funny concept of that because our work-life balance all happens right here. At MASY, our sons worked with us, their wives, our brothers, their wives. And now in our new life over here, our sons and our older 2 grandsons work with us. So we talk shop all day long. We vacation with our kids and their families. And it's hard to shut that off for us. We've been ingrained for a while. So we're not a really good example of this at all. We're probably the worst example you could find. We would do the 24/7 working if we could. And but we think that the fun part is at work here with the family. So it's just entwined for us.
All right. Now, same question for you, John. You can concur or you can add something to that.
So let me rephrase it. So you want to know about the work-work balance. Okay. I love it.
He's worse. He's worse than I am.
I know Laurie won't want me to mention this, but there was a point.
Don't say it.
Okay. There was a point in time where I thought we just get so involved in it that we had gone 22 months every day working until we didn't realize it.
No, I asked him not to say that.
I know. Well, I knew you were going to ask me that. So, and we were going to a project site on a Tuesday, and I was goofing off on Friday night, and I said, "Hey, Laurie, let's go on vacation." This is how we used to do it. Go on vacation.
Okay, that's enough of that story. The bottom line is you think other people should have work-life balance.
And we weren't going on vacation.
And certainly our staff, we believe, should have a reasonable work-life
That's
balance.
Right. That's
so
very
it's
important
one of
for our
those,
staff.
don't do
Absolutely.
as we do as we say.
That's right, yes.
Well, our
children have learned how to have a work-life balance.
That's good. That's good. And everybody's got their perspective, their approach, their opinion. Nothing's really off limits. It's not about right or wrong. It's about think about it, do what makes you happy. So I try to stay neutral on all that, and I don't let people ask.
I would only ever work at a job that I thought total satisfaction from. So here I am. I'm very happy.
Yeah,
absolutely. And I can't be happier working with Laurie all these years, sharing an office, working together. It's the best.
Well, first of all, I want to thank you both for spending this time with me on CMMS Radio. And for everybody out there, although you can find John and Laurie on LinkedIn, I want you to just go check out Predictive Monitor. And you can do that at www.predictivemonitor, you put that all together.com, and reach out to them if you want to learn about Overshield and what it can do for you. And really for everybody, these journey stories, they're important to me. This has a lot to do with maintenance, but it's highly specialized in that you're looking at pharma, biomedical, etc. And don't just go with anything out there. Talk to people that know and understand you. And I think what you would get with John and Laurie and their team is if they can't help you, they'd be the first ones to tell you. And
exactly.
With that, I want to thank you both once again for finally being here with me on CMMS Radio.
Greg, thanks for having us. We enjoyed it. I love your fun question segment.
And we enjoy following you, and there's plenty that you come up with that is very useful and helpful for us. Thank you.
You got it. Did you find this episode helpful? Please send us some feedback, suggest a topic, or ask a question. Reach out to CMMS Radio if you need a co-pilot on your CMMS project. Visit CMMSradio.com and use the What's on Your Mind link. Thank you for tuning in to CMMS Radio, your resource for all things CMMS, from selection to implementation, to help you make better choices, learn from industry experts, and have a successful CMMS journey.